Across the country, there's a shortage of home care workers who care for the elderly and allow them to stay in their homes. They do everything from bathing and dressing to giving medication and supporting them with their tasks at home. But people in the industry say that low wages make it difficult to recruit and retain these workers. Carolee McGrath sat down with Nancy Whitley and Mary Wetzle of Barton's Angels, which provides home care in the Pioneer Valley, to learn more.
The last few years, it has, come to light that all industries are having a hard time finding enough workers because the unemployment rate is so low, and it's hard to have people trained to be in any industry. But in home health care, there's really a lot riding on this, so it's become increasingly difficult to find enough people to provide all the care that's being requested of us. So we have a lot of calls from families who have been told by lots of agencies that they don't have enough providers to be able to do what it is that the family needs. So one of the things we've arrived at is that it's clear that home health care workers are grossly underpaid and undervalued and under-respected. And it's really hard to get training, it's really hard to get the kinds of benefits that people need, so it's hard to retain people in the field. People are called to do this work. It's not because it's, the high pay is, bidding them. And we would really like to see some changes so that people can be paid what is a fair wage for the importance of what they're doing, which is being in a home with a vulnerable person who needs someone who can make, judgment calls and be able to be creative in the moment, have, know when to call for additional help, be able to handle everything that comes up.
Tell us a little bit about the training and tell us about the pay scale. When you're saying they're not being paid enough, what are they being paid?
Well, it's hard to get training. It's very, there just aren't very many opportunities, and that which there is it's like 13 or 14. Now it's $1,400 for a CNA HHA training.
Okay.
And certified nursing assistant and home health aide. Training is often combined so that people can come out with both, or either certificate, but it's like $1,400, and it's also 5 or 6 weeks at least, which means the person is generally not working during that time, so they're not earning money. And so what we've been doing is in-house training. We've set up, at our expense, a program so that we can train people in a way that's more convenient for them and more affordable. Because the wage range is, in Western Mass, I would say that it's between $11.50 and probably $15 an hour. And that doesn't, many people have children, they're living...
Which you could make somewhere else
without
the training, right? I mean, that seems like a pretty low wage when you're talking about taking care
this kind of responsibility
of people and this kind of responsibility, giving people medication and the like. So Mary, why did you get into this field, and tell me a little bit about your job that you do now.
Well, I actually have a variety of clients, which it's a really great opportunity to meet people within the community. They come from all different backgrounds, and sort of their stories are very interesting to follow, and I think that really drew me to it. The first woman that I ever worked with actually hired me privately through the state program. It used to be called cerebral palsy, now I think it's called Tempest. But she kind of took a chance on me and gave me my leg in before I got to work with Barton's Angels. And it was just amazing to see how much she depended on us for absolutely everything, and the state just couldn't provide the hours that she needed. And so I actually ended up becoming a live-in for her just to cover that. So I was working like 10 to 14-hour days, 7 days a week, just trying to keep this woman on her feet, basically, and feeling supported. And there were so many days where I really thought that I wouldn't continue with it, but at the end of the day, when I finally, got to sleep or eat something, it was a really hard day, but it really was worth it because she's taken care of. She's here, feels like she can tell me anything, and I mean that's something that not everyone can say. I know things about my clients that their family members don't know, And it's such a trusting relationship. You build such a bond with people that to walk away, it's just, I don't know that I could.
Right. So you're not in it for the money. This is obviously it's a calling, and you don't want to desert people, you know. But the turnover rate is high, and the government stats are showing that you're going to need at least 1 million nationwide in 8 years of the type of workers and
there's
services.
already a shortage, so
and there's
it's just
already
gonna
a
get
shortage.
worse.
So it's going to. So how do you encourage people to go into this field if the minimum wage is going up to $15 an hour, and that's pretty much where they're at? How do you encourage people to take a chance on this?
You know, what I think my job is, I started the company 21 years ago, and I used to say, well, it's a home health care company, and it is. I mean, we provide home health care, and we serve people who are paying us privately, and we also have state contracts to do that. But really what our company is in the business of being the best employer that we can, because our best option is to have people be happy in the work and want to stay, despite all the things that are challenging about it. And, you know, we're also advocating that the state reimbursement levels become higher so that people can be paid at a higher rate.
And insurance companies, perhaps,
I would
paying for
love
this
it if
type of coverage?
it would be great if insurance companies would throw some money in the games, because what we're doing prevents people from going to the hospital, which everyone agrees is more expensive. So that social connection that Mary was talking about is life-giving. You know, social connection is now more of a health risk factor than smoking or obesity. If people don't have that social connection, they're at high risk. You know, people have a risk of falling at home. People, you know, who have poor nutrition or aren't drinking enough are going to land in the hospital. We can prevent that. We just have to decide how to pay for it.
Can you tell me a little bit day to day what your activities are? I mean, are you helping people get up, take their medication, eat? Describe some of your daily work.
So on a day-to-day basis, you know, one of the big problems actually is that a lot of people need help immediately in the morning, and so, you know, you only have so many people to go to so many places. So I might start out my day helping someone get out of bed, you know, waking up a little bit, making sure they have plenty of water to drink. Then it's basically boom, boom, boom. We have to get everything done because we have such a limited amount of time. You need to shower, get dressed. If you are incontinent, you know, cleaning up the bed, anything that might have happened. Then it's meal prep, making sure that there are 3 meals for the day if they don't get a delivered meal. And, you know, I might have 2 to 3 hours to get all of that done, so it's
and then
not...
move on to another client? Is that how it goes?
And making sure that the medication's there, that they have everything they need. Sometimes it's like, okay, let's make sure everything is in your reach, because you might not see another human being until I come in again tomorrow morning. And that's a lot of time to go without having anyone there. I mean, there are some days where you walk in and someone's been, you know, unable to get off the ground for a while, and if they don't have that help button or a means of reaching anyone, I mean, it's just devastating sometimes to walk in and feel like this poor person was alone for that long, and how can you justify that, you know? And then to be met again with that, well, no one wants to pay for it, that just seems like a ridiculous, that's not an excuse.